Hello everyone, this is Tyler with Massage AME, and in this video I'm going to talk about fibromyalgia. Now I want to make sure that it's clear to everybody that I am not a medical doctor, so do not come to this video seeking medical advice. I am a licensed massage therapist, and I'm going to discuss my experiences with fibromyalgia and people who have this condition. My experience with fibromyalgia is I have come to find that it is a very misunderstood condition. And all I can say is that people with this condition, they just express that they hurt all over, they can't explain why, and they have been looking for answers for most of their life, trying to figure out what is going on with them. And to this day, there are some that still deny its existence. Oftentimes people were just written off as, well, it was all in your head. You're just crazy, right? Get over it, move on. Well, I'm here to tell you that there actually is a medical definition of fibromyalgia, and you can find it on the Mayo Clinic website, as you can see right here. Now, I highly encourage all of you to go to the website yourself and read up on it, and also look at other sources on the web. I will provide a link at the end of this video if you want to look into it more yourself on the Mayo Clinic website. But anyway, the website does define fibromyalgia. It says it right there. A disorder characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. Researchers believe that fibromyalgia amplifies painful sensations by affecting the way your brain and spinal cord process painful and non-painful signals. So there you have it right there. As I said earlier, it's a highly misunderstood condition. You will also find that many scientists and doctors alike they really do not understand the source of this condition, but thankfully, once again, the Mayo Clinic does give us some kind of inclination as to what it may be about. The symptoms oftentimes begin after an event such as physical trauma, surgery, infection, or significant psychological stress. In other cases, symptoms gradually accumulate over time with no single triggering event. Now, as you may have seen right there, also at the bottom paragraph, it does seem to be more common in women. And again, it's hard to understand why that is. However, even though most of my clientele does validate this statement, most of them with fibromyalgia have indeed been women. But the fact of the matter is, I think there is some evidence that is showing it's quite common in men also. I think the difference, it seems to be, is that most men are likely to ignore the condition. They just don't go see the doctor for anything. So it doesn't mean it doesn't. It's not common in men. It's just that there seems to be more women who are going to go see a medical professional to express their symptoms. Regardless, though, what do you do about it? That is the ultimate question here. You hurt. You're in pain. What options do you have out there? Well, again, this Mayo Clinic article does express some possible treatments that you could use to get through dealing with the symptoms of fibromyalgia, and massage therapy also happens to be one of them. And I also wanted to mention this article that was found in the National Library of Medicine. It was a published article back in 2014. In the conclusion, it does say that massage therapy with a duration of less than 5 weeks or equal to had beneficial immediate effects on improving pain, anxiety, and depression in patients with fibromyalgia. Massage therapy should be one of the viable complementary and alternative treatments for fibromyalgia. And it does mention there too that there are some caveats. It does remain controversial. If you want to read the entire article, I will provide the link as well. It's a very interesting study that was done back in 2014. There's also many other articles that you could look at yourself and decide for yourself, is massage therapy right for you when treating your symptoms of fibromyalgia. So ergo, as a licensed massage therapist, I do recommend getting a massage to treat the symptoms of fibromyalgia. But again, you should consult a medical professional, your doctor or otherwise, and find out if it is indeed right for you. And I guess the other question may be there too, what kind of massage? Do I just get light pressure? Do I get deep pressure? And that's really up to you and what you're feeling up to at the time on that particular day. I have found that both are effective. So it really is up to you, and it is between you and your massage therapist and how you go about that. Now, one last thing I did want to discuss here. for both the benefit of the massage therapist and also for the potential client with fibromyalgia. There are these tender points that are used as a criteria for diagnosing fibromyalgia. This is just something to be aware of. Now, I need to make sure I give a stern warning to massage therapists. Do not use this image here to diagnose somebody with fibromyalgia. We don't do that. We do not have that authority. We cannot diagnose people, but we need to be aware of these points as they may be more tender on the body. And you can see that on the back there, in the upper part, there's 4 in particular. Then we move down to the lower back, there's 2 on either side. It's bilateral in case you didn't notice. On the hips there, near where the greater trochanter is. Then we move to the anterior side of the body. We also can see that there's 2 on the front part of the neck there, down towards the clavicle, the upper chest region, bilaterally in the cuboidal space there, and also in the inner thigh region just above the knee. So we need to be aware of these points as well and understand that these might be extra sensitive to people with this condition. Now, some closing thoughts I have on fibromyalgia and as a massage therapist from that perspective, and also the perspective of the client potentially if you are viewing this video. The ultimate goal here of this video is to provide some information and to enlighten and to inform, and hopefully it has been useful to all of you. I certainly hope it has. And I want everyone to just focus first and foremost on safety and make sure that we are working together, both as the therapist and as the client, and that we are keeping each other informed, and also that there is effective communication with all the medical professionals that may be involved in this. So altogether, what I ultimately want is just for you to feel better and just enjoy your massage, have a good experience with it. And if you did like this video, please by all means subscribe to this channel. Give this video a thumbs up. It means a lot to me. I put a lot of work into this stuff to try to give you guys something to think about, something that'll benefit your practice as a massage therapist, and also just to the general public, just to help you guys be more aware of massage and its potential benefits. And if there's anything else you would like to see done, please feel free to comment about that. I am more than willing to hear recommendations and just anything that you might want to see done. So thank you again for watching, and once again, like and subscribe.